Hello, everyone. I'm Dr. Brooke Friedman, one of the fertility specialists at San Diego Fertility Center. I'd like to talk today a little bit about surrogate selection. We know that if you're planning a surrogate journey, it can be overwhelming to think through, well, how do I select the best surrogate for my surrogate journey? We're here to help, and we're here to help you each step of the way. I want to really focus today on surrogate selection and the process and our role as your fertility clinic in terms of helping you choose the best surrogate. So the process to selecting a surrogate really starts with your surrogate agency. They will present candidates to you, and you will, once you feel comfortable with the candidate presented to you, accept that match. The surrogate agency sends us as your clinic what's called a match sheet, basically saying that you as the intended parent and the surrogate have this preliminary match established. The next step for us as your fertility clinic is to request all of the surrogate's medical records. This is a really important first step, and we do this prior to seeing the surrogate for in-person medical screening. So the first step is requesting all of her medical records from her previous deliveries, for her previous medical records, so that we can review everything in detail to make sure there are no red flags, to be sure that she has had uncomplicated pregnancies in the past, and to be sure that she's healthy. It's really important to be sure that the surrogate is healthy, both physically and mentally. Our primary goal is to help you have a healthy baby. And in order to help accomplish that, we want to make sure, to the best of our ability, that we help you select a surrogate that's healthy, both physically and mentally. This is so important both to our success rates as well as helping you achieve your goal of having a healthy pregnancy and delivery. So after we've reviewed all of the medical records to ensure that this surrogate is an appropriate medical candidate, we schedule an in-person medical screening appointment at San Diego Fertility Center. So taking a step back, what are we looking for in that medical record review? We're looking for several things. At the minimum, a surrogate must have had at least one uncomplicated delivery. That's an absolute minimum requirement. It's also recommended that the surrogate has had no more than 5 previous deliveries. And it's recommended that the surrogate has had no more than 3 previous cesarean deliveries. Now, why is that? So these are recommendations which have been provided to us by the American Society for Reproductive Medicine. So ASRM, or the American Society of Reproductive Medicine, has published guidelines for practices such as ours, for all practices across the United States, who are utilizing gestational carriers or surrogates. And part of these guidelines lay out what we're looking for in a surrogate. So at the minimum, one uncomplicated delivery. Like I said, no more than 5 previous deliveries and no more than 3 previous C-sections. And that's because, for example, if a surrogate has had more than 3 previous C-sections, she could be at an increased risk of pregnancy complications in a future pregnancy. So our goal, as I said, is really to help find a surrogate that's healthy both physically and mentally for the sake of your future child. But also, we want to do everything that we can to ensure that we protect the surrogate's health as well. So we never would want to help encourage someone to become a surrogate if doing so would jeopardize their health and put them at undue increased risk of pregnancy complications because of their prior history. So we spoke about previous number of deliveries. ASRM also recommends that the surrogate is between the ages of 21 and 45 and is healthy, both physically and mentally, like I mentioned. For us, we're also looking at additional criteria, such as things like body mass index, for example. Ideally, it would be preferable for a surrogate to have a BMI under 32. And we say that because with increasing BMI, there is a slightly increased risk of pregnancy complications, such as gestational diabetes or high blood pressure. And again, we're always looking with an eye towards how do we minimize the risk of pregnancy complications. Additionally, we want to ensure that the surrogate is not a smoker, for example, and is not taking any medications which are contraindicated in pregnancy, and making sure through her health history that she herself does not have any personal contraindications to a pregnancy. So this is all the things that we're looking for within the medical record review process prior to even meeting the surrogate. So once we've reviewed the medical records and everything looks as we would hope and expect it to be, we say, great, we've completed your medical record review. Let's schedule the next part of our screening, and that's the in-person medical screening in our clinic. We invite the surrogate here for screening. And for us, this is a really important step for us to be able to meet the surrogate, speak to the surrogate, and perform a thorough evaluation, as well as answer all of her questions and discuss next steps in this journey. So we do a blood test to evaluate for things such as infectious disease, drug testing, and evaluating the hormones necessary to have a healthy pregnancy prior to conception. We're also doing a very thorough physical exam, checking things like height, weight, blood pressure, and doing a physical exam, doing an ultrasound to look at the uterus and ovaries, as well as doing a special ultrasound called a saline sonogram or a water ultrasound. This is a test where we put sterile water inside the uterine cavity to distend the cavity to look inside to be sure there's nothing subtle that could be interfering with a future embryo transfer. We want to be sure that anything inside the uterine cavity, everything looks normal prior to proceeding with that next step. The blood tests take approximately 7 to 10 days to come back, and we will update you as we have results returning. At the conclusion of that first visit, however, we'll be able to let you know, good news, we met with your surrogate, the ultrasound was normal, the saline sonogram was normal, and to update you regarding our findings that day. As far as next steps, once we receive all of the blood tests from that visit, we'll be able to update you and say, good news, we now have everything. And at that point, sometimes there are small factors such as a surrogate may not be immune to things such as rubella or varicella, viruses that if contracted in pregnancy could cause a problem for the pregnancy. And we recommend having a vaccination booster, for example, prior to proceeding with an embryo transfer. And those are things we could talk through together if that occurs. So sometimes there are small things, for example, the vitamin D level might be a little bit on the lower side. And again, we're always looking to how do we optimize everything prior to an embryo transfer. So we may recommend some vitamin supplementation prior to an embryo transfer to ensure that everything with the uterine environment and the surrogate's health as a whole is optimized prior to an embryo transfer. So at the conclusion of that medical screening, we let you know, good news, medical clearance has been achieved. And at that point, typically patients are proceeding with completing their legal contracts. Sometimes it's done before, but usually that legal contracts they're completed after medical clearance. And then once we have medical clearance and legal clearance, then comes the exciting part. We can move forward with that embryo transfer. Now that we all can feel really confident and comfortable knowing we've looked very closely at every aspect of the surrogate's health to be sure that we're optimizing things before an embryo transfer. Absolutely, it's normal and common to have questions along the way. And we completely understand that this can feel like an overwhelming process. That's why we're here as your advocate to help explain this process and help guide you through this evaluation of each surrogate candidate to be sure we're helping you pick the very best surrogate for your journey. So if you have any questions, we're always here to help, and we look forward to helping you in this next exciting steps towards parenthood through surrogacy.